Welcome back to PrepSolution's CCRN question of the day. Here's the scenario. An individual on synchronized intermittent mandatory ventilation is being turned by a nursing assistant. During the turn, the patient coughs and becomes agitated. Watch the cascade. Task starts, routine turn, event, cough and agitation, airway, peak pressure alarms sound, brain, ICP spikes to 28. An hour ago, this turn was delegable. Right now, it is not. The floor cracked mid-turn. Your four options: Option A, require the RN to directly supervise and assess during repositioning. Option B, transfer clearance for repositioning to respiratory therapy. Option C, instruct the UAP to give prophylactic hyperoxygenation. Option D, switch to a kinetic therapy bed and stop manual turning. Pause here. Pick your answer. Ready? 3 answers either hand the call to the wrong role or paper over the instability. 1 walks the task back into RN hands where it now belongs. The correct answer is Option A. Require the RN to directly supervise and assess. Why direct RN supervision? Picture the delegation rules as a floor inside the room. 3 task chips drift across the floor: vital signs, bathing, turning. The UAP carries them all as long as the floor stays solid. Now the cough hits. Intrathoracic pressure climbs. Cerebral venous outflow drops. ICP pushes past the 22 threshold and lands at 28. Underneath the chip labeled turning, the floor cracks and drops away. The task did not change shape. The floor under it disappeared. The RN is the one who can carry that chip across the gap. Continuous ICP read. Live judgment about when to pause the turn. Authority to call the team to a stop. Respiratory therapy can help with the airway. The UAP can be present and watch. Neither one of them owns the call to stop the turn when ICP climbs again. This is not a question about who is allowed to put hands on the patient. It is a question about who is accountable for the call mid-motion. That is the RN. The role does not change because the patient is unstable. The visibility of the role does. Stability sets the threshold. Instability brings the RN back. The 4 stability gates: airway, no alarming peak pressures, no new desaturation; hemodynamics, MAP within target; no new pressure titration; neurologic, ICP stable below threshold; CPP at goal; behavioral, cooperative; no agitation that raises intrathoracic pressure. All 4 gates open means delegable. 1 gate closed means RN at the bedside. 4 moves at the bedside. 1. Pause the next turn. The task is paused, not transferred. RN must be present before the next reposition. 2. Pre-medicate and pre-oxygenate. Per provider orders. Sedation, analgesia, 100% oxygen for 2 minutes before motion. RN sets the parameters. 3. Turn with the RN at the bedside. Continuous ICP read. CPP watch. Pause the turn. If ICP climbs again, RN owns the call. 4. Update the care plan. Document the threshold change. Communicate to the next shift. RN supervise turning until the patient stabilizes. The patient sets the floor. The RN walks the task across. Why the others fail? Option B, hand clearance to respiratory therapy. Respiratory therapy partners on airway management. The RN keeps statutory responsibility for hemodynamic and neurologic tolerance during mobility. Handing clearance off does not remove the RN obligation. It just shifts the documentation. Below the floor. Option C, UAP provides hyperoxygenation. Adjusting the ventilator is outside UAP scope. Even if the UAP pressed the right button, the ICP spike is not just an oxygen problem. The intervention is unsafe and the diagnosis is wrong. Below the floor. Option D, switch to a kinetic therapy bed. kinetic beds still move the patient. Movement still raises intrathoracic and intracranial pressure. The bed is a tool, not a substitute for nurse assessment during physiologic events. Below the floor. Below the floor, the RN walks the task across. If you want to pass CCRN the first time, PrepSolution has you covered. 1,200 clinical questions across all body systems, 3 full-length mock exams, 1,000 high-density flashcards, the Clinical Decision Masterclass, an adaptive 12-week study calendar. Thanks for watching. Practice every day. Pass with confidence. Please visit PrepSolution.com/exam/CCRN for more information.